Welcome to the next step. This is the step 3, critically appraise the evidence. I'd like to begin this video with a thoughtful reflection from the amazing Mafalda. The dangerous thing about living without reading is that it forces you to believe what you are told. So, in the evidence-based practice process, it is essential to read the documents retrieved during the search and critically appraise each study. This allows us to gain a comprehensive understanding of the publication on the topic and assess the validity of the studies. This step is known as evaluation or critically appraisal. The process of critical appraisal consists in answering 3 questions that are applied to any study. As you can see in the slide, first, we have to evaluate if the studies found are valid, if their results are important, and lastly, decide if we can apply them to our patients. Let us start with internal validity, the first question that we have to respond. Internal validity refers to the extent to which the results of a study accurately reflect the relationship between the variables being studied without being influenced by external factors or biases. In other words, we must detect possible systematic errors or biases that could occur during the development of the research. In the slide, you can see the main phases of the research process that include, let me show you, the first research question, then we decide what is our study design, and then we must take for a sample selection. The second part is that we have to evaluate the intervention or exposition of the patient or subject of the study. Then we must measure the variables of interest. We do a data analysis, and finally we interpret the results, and finally we found the truth. But this occurs just if we have done this process correctly and we don't have any error during this process. However, many times we can find several systematic errors or biases, like selection biases, during the first phase of the process when a non-representative sample is chosen. Also, we can find other type of biases that we call measurement biases. Those biases occur during their evaluation and recording of the study variables. And finally, in confounding biases, which can be controlled during data analysis, this bias occurs when an external factor known as a confounder is related to both the exposure and the outcome, distorting the true relationship between them. This can lead to incorrect conclusions about the cause and effect in a study. This is the second question that we must respond in the critical appraisal. When I read a research study, how do I assess if the results are important? And what impact do they have on the outcome as studied? You should address the magnitude of the effect on the results of the study. Not confuse statistically significant with clinically relevant. Let me show you an example. This is a study, it's a systematic review that is, the title is Music Therapy in Pain and Anxiety Management During Labor. In this systematic review, the authors select 12 randomized controlled trials. The aim is to know if the music therapy reduces the pain during labor. This is a very useful intervention, low cost, but we need to know the effectiveness of this. And here we have the results. Don't worry about the data, I'm going to interpret the result for you. When examining the results of the systematic review, we observe here, this is the final result, here and here, we observe, as I told you, a difference in means between the group of women with music therapy and the group who did not receive it. You can see here that there are a difference of lower 0.68 points, with the confidence interval indicates that the results are statistically significant. We can see here that the results are significant, but this is not only the important question. Really no. What is very important, as our friends Danny and people say here, you can read a little. Well, as our friend said, the difference of 0.68 points over a maximum of 10 points is not very important or clinical relevant result. So this is the magnitude that reduces the intervention. So we must think if this is really relevant for our patients. So this can help us to decide if we choose or not to do this intervention. This is the third question that we must to respond when we do an appraisal, critical appraisal of our studies. The last question is we should ask if we can apply the conclusions extracted from the studies consulted to our patients. That is, we have to evaluate the characteristic of the subjects with whom the study was conducted, as well as the context in which it was performed. To evaluate the applicability of the results of the treatment or intervention study to the patient we provide care for, we have to answer these questions. Are the study subjects similar to the patient we will provide care for? Are the benefits or the treatment greater than the risks? Can the treatment be applied in my healthcare environment? And finally, does the patient decide the treatment? This implies that a study in which the effectiveness of a treatment was demonstrated with patients who were a specific age or had a personal characteristic or a specific lifestyle may not have the same results in your patient is their characteristics are not similar. We also have to consider the characteristics of a care center services and the severity of the health condition. Due to this, obtaining results from studies conducted with patient samples of diverse characteristics, surroundings, and contexts increase the transferability of the results to our patients. Thus, we must reflect on if their benefits that the patient will obtain when applying a specific intervention, considering the possible impact on her or his health, overcomes the risks and costs. It is important to mention that to help us critically appraise and evaluate the validity, reliability, and relevance of scientific studies, we can use checklists developed by organizations such as CASP. This is the Critical Appraisal Program. You only need to search if you want to check this checklist. Only need to search for CASP in your search engine, and you can download this tool for free. Here you have a checklist for the critical appraisal of systematic reviews, randomized control trial, also qualitative studies, and many other type and different type of studies. Okay, so after critically appraising the studies retrieved to address our clinical question, a system of equivalences has been established to aid in deciding whether to apply the results. The system determines the strength of the recommendation for a body of evidence based on its level of evidence. The higher the strength of recommendation of this set of evidence, the greater trust we have on the results obtained, and therefore the greater the recommendation for their application with our patients. GRADE stands for Grading of Recommendation Assessment, Development and Evaluation, provides a common and transparent approach to grading quality or certainty of evidence and strength of the recommendation provided in clinical practice guidelines and systematic reviews. It is the most widely adopted tool for grading the quality of evidence, including the World Health Organization and the Cochrane collaboration. After the search for evidence that tries to answer the PICO question, the grade system follows a process organized in two parts. In the first part, we must rate the quality or certainty of the evidence. It refers to the extent to which we are confident that an estimate of the effect or association is correct. The rating of the quality of the evidence is based on three aspects for establishing how confident we can be in that we know the real effect on an intervention. These aspects are study design. Here we can see that clinical trials are initially considered as high quality, while the observational studies are considered to have a low quality. But at the same time, we can apply 5 factors that we show here. These factors could decrease the quality of the evidence 1 or 2 degrees. And also there are factors we have here that increase the confidence. Those are that you can see here. After that, the second part is that by integrating these 3 aspects, the grade system established 4 levels of quality of evidence. We can see here the high quality level came from studies with high level of certainty. It's not very probable that new studies change the estimated effect. This is the consideration of high level. Moderate quality, although we trust that our estimation is close to the authentic effect, it is possible that new students could substantially change the estimation of the effect. Low quality means that the real effect of the intervention can be substantially different from our estimation. And the very low level or very low quality, it is probably that the real effect of the intervention is substantially different from our estimation. We lack evidence. Finally, the last step of the grade system is to elaborate a recommendation, starting with a set of evidence and having in mind the score of the quality of evidence, balance between risks and benefits, values and preferences of the patients, estimation of the consumption of resources over cost. Each recommendation is classified according to the strength of the recommendation into strong recommendations, indicate that the intervention must be offered to all or almost all the patients if in favor of the intervention, or should not be used with any or almost any of the patient if against it. And the weak recommendations indicate that what it proposed should be considered in light of the clinical circumstances and the preferences of the patients. Here we can see an example on how the National Institute for Health and Care Excellence, the NICE, has made the evaluation and critical appraisal of the evidence to respond about the effectiveness of different diets in achieving and maintaining weight loss. And I would like to show you here the where we can see here is the bibliography site of the study, the type of design, and here are the different factors evaluated and considered in the critical appraisal of the study. And here is the score of the certainty or quality of the evidence for the different type of effect. Here is for the weight, it's moderate. Here is the other one, is low, and for this one outcome is moderate too. So this is an example how it's using to make the decisions in the recommendation of the clinical practice guidelines. So thank you very, very much for your attention, and see you on the next step.